Everybody, I am Dr. Jordan over here at Advanced Spine, Joint, and Wellness in Medina. I'm one of the chiropractors, and I'm going to talk to you about sciatica, or just more in general, pain shooting down your leg. Now, when we see a patient come in with this, it's usually coming from a couple different areas. Imaging is always great. It helps us narrow down whether it's truly coming from your hips, your low back, and what we need to do to get that pressure to release. So with sciatica or pain down the leg, a lot of times typically what we want to start by looking at is your hips. Are your hips in good alignment? Sometimes our hips can be way off, and maybe I'm exaggerating a little bit, but what this does is it'll put a lot of pressure on one side of our lower back, compressing and tightening those soft tissue areas, putting pressure on our nerve and shooting down that leg. What we do to fix that pelvic or hip alignment is what's called drop technique. We level out your hips through this drop techniques, which then takes that pressure off of there. Your nerve starts to heal up, and we get rid of that pain radiating down our leg. A lot of times this can also lead to what's called disc bulging or disc herniations. And yes, that is in our lower back, but sometimes our hips can lead to that. But still, we want to address the lower back to get that pressure off the disc. Now, what we want to do for that are side posture adjustments. That's typically, if you've seen in some of these videos, we have the patient laying on their side, we adjust their lower back, you might hear a click or a pop. What that is doing is, in between each bone, there is a disc. Now, sometimes through life we have trauma, or just some of our parts wear out on us a little bit faster than others, and those discs in between those two bones, so right here to the two bones, here's your disc, sometimes there's a jelly in there, and it can either push on the outside of that disc or it can actually protrude, which would be a herniation. My job is to get those two bones on top of that disc moving. By doing that, we're releasing pressure on that disc and allowing it to heal up. This will also help to alleviate some of those pains going down your leg. Now, when it's pain going down our leg, if it's really coming from a disc, you might notice it as sharp shooting pain, burning, numbness, tingling, pins and needles. That's a lot of the times we kind of use that to differentiate, hey, is it coming from a disc bulge or protrusion? Whether if it's just pain going down the back of your leg, stopping at your knee, that might more be hip or pelvic related, and that's more true sciatica. Either way, it's pretty much the majority of what I see on a daily basis here, and we are very good at getting results with these different sciatica or pain going down your leg issues. So if you do have anything like this going on and you'd like to get it checked out, please do not hesitate to give us a call. We are more than happy to talk to you about it. All right, have a good one, guys.